Hi, good morning. Again, I'll introduce myself. My name is Barbara. I'm a specialty therapist at Sierra Tucson. So what the heck does that mean? I am the head of the positive psychology program here, which is a new program that we implemented this last summer. And also it's going really well and a lot of good feedback. Um, and I really enjoy it. And then I also do work with trauma. So um, trauma in group settings, trauma education, as well as individual sessions with trauma, people who have experienced trauma. So that's pretty much me. And I have a background in family systems as well as mental health and behavioral health. Um, and I have my own story in terms of recovery as well. So I'll share a little bit about that today as we go on with the webinar here. So yeah, let's get started. Parenting post-treatment can be really, really difficult. I work with a lot of individuals who really struggle with being able to shift roles, being able to communicate with their children, and forming this new path towards healing and growth and recovery along with their children. So I thought we would start with some numbers. Um, Here we go. Okay. So when we look at the numbers in terms of substance use disorders in particular, um, there's over 8.7 million children in the United States who are affected by this in terms of their parents or their caregivers in their life having a substance use disorder. So there's quite a few children who are really, really affected by this. The results, as you know, turn into probably removal from their homes, switching of caregivers to a family member, what have you. And this can, as we know, can be really detrimental in terms of attachment and that sort of thing. And then if we look at the little diagram on the side, the little graph there, there's only 2.6 million individuals who have substance use disorders that actually receive treatment out of the 23.5 million people who are affected by this. And there's a lot of barriers to that, barriers like childcare, being able to find someone who can actually watch their children and care for their children while they're away. If they're in residential treatment and or doing outpatient or PHP, having that childcare is a really big barrier for a lot of people. Finances, we can talk about oppression, we can talk about low income and all of these things all day. But when it gets down to it, finances can be a really big struggle and something that can be a deterrent to actually seeking treatment. And then we think about also geographic location. The ability to have these sorts of things around you can be difficult depending on where you live. And so we think about travel and that sort of thing as well. And then we talk about stigma in terms of receiving treatment for substance use disorders, mental health disorders. That sort of thing can also prevent people from actually going forward and asking for help and seeking treatment that they so desperately need. And then another one is lack of resources. This can look in various forms, some of them that we've already talked about in terms of finances, childcare, that sort of thing. And then oftentimes substance use disorders are accompanied by other struggles such as mental health, chronic pain, trauma, and mood disorders as well. And so finding treatment that works with all of these things, or at least a couple of them, isn't always readily available. So a lot of centers or a lot of therapists will only focus on the substance use or will only focus on the mental health as a primary treatment goal. And then we have a 62% remission rate for individuals addicted to alcohol after treatment. That's a pretty good percentage. I just wanted to throw that in there just for, another number there. And then when we talk about child maltreatment, there's about 79% of maltreatment reports involved in the welfare system, involved a parent with substance use disorder. So that's a pretty high number of children who are being removed from their homes due to maltreatment. And maltreatment can look very different. It's not always related to substance use disorders. However, in this scenario with the 79%, it is involved a parent with substance use disorders. And then also there's about approximately 40% of children in foster care who were removed due to substance use disorders. So that kind of gives you a good foundation, I think, of how impactful substance use disorders in particular can be on children. So now what do we do with all of this? So I'll share a little personal experience. I am an individual who has been through recovery myself, attended a residential treatment center, struggled with postpartum depression, complex trauma, these sorts of things. And so this presentation really hits home for me in a lot of ways. And so I think we as clinicians play a really big role in how successful someone might be going forward in terms of maintaining sobriety, wellness, and improving mood and that sort of thing. So I think it's really important to try to avoid disengagement. So having a plan going forward, and what are we going to do when this happens, right? Because there's statistics that show that 1/3 of patients with serious mental health illnesses will disengage at some point during their treatment. And there's a lot of factors that play into that, such as self-confidence, cognitive distortions, core beliefs, these sorts of things, as well as some of the barriers we talked about earlier. And it's really important that not only are we an active role in all of this, but that the person that we're working with is also an active role in their treatment. We can't do everything and neither can they, so we got to work together a little bit to make sure that we meet their needs along the way. And now if we look at things from a trans-theoretical model of change, right? We talk about pre-contemplation, contemplation, preparation, action, maintenance, and termination. So we can see the changes along the way, obviously, if someone's being an active role in their treatment. But when we relate this to parenthood, parenthood can really be a catapult for a lot of people to go from pre-contemplation to preparation very quickly because it's a motivator. They want to get better for their kids. It's really important that they're well, and they want to be a good parent. And also it can even take them from the pre-contemplation stage sometimes all the way to action and or willpower. So that's really cool to see. And I've seen that in my experience and in my profession as well as seeing this huge motivating factor of having children and wanting to be a good parent to push them to go a little bit faster, but at a pace that is still appropriate and is still safe. I think at the end of the day, mental health matters, right? Self-regulation is important. And the ability to attune to and attach and connect becomes really, really paramount. And we're going to talk about some of these things that I just mentioned a little bit more in depth as we go along. So hold on with me and we'll get there. So now that we've kind of got an individual a little bit engaged in treatment and we're working together, I think it's important to work on this communication piece. As someone who was in treatment with very, very young children, this was one of the biggest struggles for me, was being able to communicate with my children about what was going on, why mommy was in treatment, why these sorts of things were happening in their life that were happening before treatment was going on. Now, I had young children, and so the age appropriate dialogue was a little bit different. But I think it's important that we encompass all different ages of children and adolescents, because I get a lot of questions on the daily about how do I talk to my children about this, right? And so we're going to address some barriers. We're going to address children and their intuition, and also age-appropriate dialogue. So let's just go through these barriers really quick. So one of the biggest barriers for parents in terms of communicating with their children that I've seen is fear. Really a lot of fear of the what ifs, what could happen, right? And also fear of like not knowing how to say these things. So that's a really, really big barrier. I have a lot of people that come to me and they're like, how do I tell my children about this, right? And then we have the emergency thing. So if a parent is in an emergency crisis mode, oftentimes the communication about what's going on and what sort of things that they're doing to get better is not always they're not always able to have that happen before they go to treatment. Um, a really huge one here is shame. A lot of parents feel a lot of shame about their behaviors, and also guilt, remorse, right? These are really big things that we talk about, especially with trauma, people who have experienced trauma, as well as mental health and addiction. But shame can really be a big barrier because it limits us. It limits us from connecting with self and also connecting with others. And when we're talking about healing with our children, eliminating shame as much as possible can really facilitate growth and healing. A lot of parents will say, I'm a failure. I failed my children. And that, along with the shame and the guilt, can prevent us from actually communicating some of these things. And we can talk about emotional regulation and emotional awareness and acceptance, as well. And this is the dialogue about emotions with our children as well. Some people don't have that dialogue with their children in terms of being able to communicate exactly what they're feeling and what that looks like. And then we have conflict, right? Conflict is really big, because oftentimes people do not communicate because they don't want to cause conflict. So if we have an older child, adolescent, for instance, well, there might already be friction there in the relationship. And so adding on something else might cause more conflict. Also, we can think about children who have been removed from the custody of that parent, are with another parent, or are in caregivers' homes, and they don't necessarily have contact with those individuals. And if they were to try to, there might be some repercussions for that. All right, so let's move on to intuition. So I have an 8-year-old, and he is very intuitive. And those of us who are parents and have children can probably relate to this, but he picks up on pretty much anything, whether it's verbally said or non-verbally communicated. He picks up on everything. So he's very empathic. And so we have a lot of dialogue in our home about emotions. We have a lot of dialogue about what those mean, what they look like, what they feel like. And oftentimes, children have already picked up on something isn't quite right, before individuals seek some sort of treatment or therapeutic intervention, or behavioral intervention as well. They're so observant. They know that something's not quite right, whether they're comparing to other children and families or it's just within their home. Again, we can talk about attachment and what facilitates healthy attachment and things like that, but I feel like that's a whole nother topic for another day, right? And then also, I think it's really important, when we're thinking about communicating with our child, when we're thinking about this healing process with our children, is that we realize that they're resilient. They really have the ability to bounce back. And I think us changing our roles and being an active part of that, and also our personal healing or the individual's personal healing can help them stay resilient. Okay, and then let's get to this important part, the communication. So age-appropriate dialogue. So when we think about children who are under 5, um, their cognitive abilities and their abilities to communicate are very different than children who are over 5 years old. And so under 5, these children might not be able to understand. They might not, and it might not be appropriate to go into certain details. Um, I think the important part is to be able to reassure the children that there's no danger, that the parent is in care of doctors, in order to ensure safety and in order to ensure the health of our children. Now, something like, mommy's sick or daddy's really sick and they just need to go to the doctor to get some help. That I see as the most effective way to communicate with children over 5, because most children, or under 5, most children under 5 have been to the doctor. Most children under 5 have been sick at one point in time, and they know that going to the doctor is probably a safe place, and then the doctor is almost always able to help them feel better. So this is something that they can relate to, that would make sense in their little tiny hearts and brains, about what's happening. Now, and again, the reassurance of, mommy or daddy is safe, and that they're going to come back and that sort of thing. Depending on the situation, that might be something you'd be able to tell them. Now, huge part of this is discretion, understanding your child and knowing your child. This is not a one size fits all thing. Every situation is different. It's not black and white. It's very subjective. So using that discretion as a parent, being able to know what's appropriate and what's not. So let's go to over 5. So over 5, we could probably get into more details, like why is substance use disorder happening, or illness, or mental health, or trauma, etc., and why treatment is needed. So we might be able to go into more details. I think also it's important to reassure here as well, and the discretion too. So we might be able to say, you know what, mommy or daddy experienced this, and so that's why they've been doing this behavior, and they need help in order to feel better, in order to be better, in order to be a better person, a better partner, a better parent, right? So again, discretion is really important. How I talk to my 8-year-old is not the same way that I talk to my 5-year-old, and how I talk to a 16-year-old might not be very different than how I talk to an 8-year-old. So again, details, what's appropriate for your child at that time. Now, sometimes it's probably not even appropriate to talk about these things, but eventually down the line, again, children are really perceptive. They're really intuitive. They pick up on things. And so over time, we might start talking about it a little bit more. Like, remember when mommy or daddy went away? This is what was happening, right? So that they have some sort of understanding of what was going on. Now, there's some myths, and I use that lightly in quotations because a lot of people have these assumptions or these beliefs about what's going to happen to their child when they receive treatment, or them as a parent, or how their child is going to view them as a parent. So one of the ones I hear often is like, I'm going to go home, I'm going to get back to life as normal, and everything's going to be okay. Well, it's easy to assume that once someone is stable, that they will be well again, that they can go home and resume life as normal. But this is really a dangerous belief, because patients who have been in some sort of residential treatment or intensive treatment, they're only momentarily stable. This is really just like a baseline, get you grounded, get you safe, get you emotionally regulated, so that you have a little bit more skills and education going back into your day-to-day life. So it's important to kind of work with individuals who have this belief, and help them kind of shift that a little bit in order to make things kind of more of a reality for them. The other one is I'm a failure as a parent. Now, I felt this when I was going to treatment, and I have a lot of individuals tell me this as well. Um, and so debunking that in a way, for lack of a better phrase, can be really powerful. Yeah, we make mistakes. Yeah, we probably make some decisions that aren't the best decisions. That doesn't make us a failure, right? And that also now here reassuring and pulling on strengths and saying, hey, you know what, you're doing the right thing now, you're working towards becoming a better person. Right? And then my child doesn't know. I promise you, the children do know. Right? And we talked about some of those things earlier. And then the biggest one I get all the time is my child's going to be messed up forever. My child's going to end up in a place like this one day. And so I think as we go forward, healing and learning and growing, that we pay attention to some of these things, and some heart and soul space will open up in order for us to facilitate this nurture. And then, so what's next, right? Emotional regulation, coping skills, education, and modeling behavior. All of these things, I think we probably all have a pretty good handle on in terms of being able to regulate emotions, coping skills, especially self-care is really important when we leave treatment and are engaging with our children again in our other roles, and also utilizing the coping skills that we've learned. Now, education about parenting, substance use disorders, mental health, trauma, et cetera, can help us facilitate conversations with our children. And then we get to modeling behavior. This is one of my favorite ones is, I'm sure some of you have heard the saying, do as I say, not as I do. And there's beauty to the saying, and also I think it gets really complex as well. And it acknowledges that individuals are imperfect. And it also is this contradictory thing as well. So being able to, as a parent, model the behavior that we would like to show our children can be really helpful. So I know we're just about ready for Q&A, but I want to kind of touch on some of these things in terms of changing roles and identities. Once someone has received some sort of intervention, treatment, therapeutically or behaviorally, roles change, identities shift. This is a major life transition. So coming to a point where we can understand self and our children is really important. Connection. So how can we connect with our children in a different way? This really improves the quality of the relationship through communication, compassion, and vulnerability. Now, compassionate care, kindness, empathy, sensitivity, these things all help foster attachment. Empowerment, gaining this sense of control, the choice, a voice, not only as the individual who has been participating in these sorts of interventions, but also the children being able to create that for them as well. And we can get really creative and be really conscious of some of these strategies to help provide safety and a sense of security. Just for sake of time, I kind of want to just introduce this. This comes from a woman called Robin Kozlovich, and talks about accepting the past and the uncomfortable emotions when we think about past traumas and events in our life that have led us to where someone might be, right? And then accepting the discomfort, right? This is the emotional regulation as well. Being able to integrate some of these things that maybe we have learned in our experiences, and integrating the wisdom that comes along with that. Now, and then let's talk about the mission really quick. The mission piece really encompasses motivation and meaning, right? So we want to turn the identity of a parent to a parent who will do right, so that we can use the motivation to parent consciously and make also meaning of what has happened in the past, especially if abuse or something like that has led them to making changes in their life. Now, this is just kind of a little kind of how do we reweave, the future. Healing. So there's this wonderful thing that's happening in Australia, and I think it would be cool to adopt it here in the United States somewhat, but it really helps the Aboriginal and other Native Islanders in terms of parenting and undoing cycles of trauma, so that they can go forward and parent their own children in a different way that nurtures, that has love, support, healthy attachment, these sorts of things. In the future, it's really important that we support and that we have support. So whatever those resources look like, therapeutic interventions, psychiatric medications, AA groups, and also maybe a new tribe. Now we have change in law is a loss and rebirth process, right? So when change happens, we're losing something, and then also we have this ability for rebirth and growth, and then nurturing the future. So in order to do that, individuals have to nurture themselves first. And that's how we start nurturing the future. And then once we've nurtured ourselves, self-compassion, loving kindness, these sorts of things can not only nurture ourselves, but also nurture the future. I know we kind of blaze through lots of these things, but that's pretty much the end of my presentation. So I'm open to questions. So let me pull up this question bar here. All right, so as I'm reading these, let's see here. All right, well, actually, there's a really good comment here. Someone was told at one point to not overload the children with information. And that if children ask more or want to know more, they will ask. I agree with this statement. And also, I think there's some things that probably we can take into consideration here. Yes, giving a child too much information, more than their little hearts and heads can handle, can be really overwhelming. And then we get into anxiety and worrying and all of these sorts of things. This is really true for my 8-year-old. He does this a lot. And so not only do I connect with this on a personal level, but also I see this happening in our in my work with individuals. But yes, if a child wants to know more and there's also already healthy communication patterns, they'll ask, right? And so it's important that we lay the foundation for open communication beforehand. And this is often hard when compounded with struggles with substance use disorder, mental health, et cetera, right? Oh, great question here. What are some specific strategies for communicating with teenagers? We all know teenagers are really difficult to communicate with, right? They're trying to make sense of the world and their place in the world, right? So communicating with teenagers, I found in my practice is also being able to have, well, let's talk about DBT for just a second and interpersonal effectiveness, right? Being able to ask for what you want, being able to say no, being able to communicate in ways that aren't going to harm the relationship, right? So some of these strategies might look like being very truthful. And because we all know teenagers can see right through the BS all the time, right? And they know someone's being truthful or not. So being truthful really requires thinking. It requires timing. It requires tact. And it also requires empathy. So when communicating with our children about these sorts of things, it's important that we're truthful, first off. And it's important that we allow them to be able to voice and express whatever's on their hearts and minds as well. And so holding space for them is really powerful. Validation, because it's oftentimes they've really been affected by whatever's going on in the home, or whatever as the behaviors the parent has done. And so they might need a space to be able to communicate some of those things. So being truthful, holding space, and then also validation and empathy. These are really some important aspects that we can take into consideration and actually apply with our teenagers. Again, it's not a one size fits all, so take into consideration the discretion and ability to know what's appropriate for that specific individual. College age children. Okay, so I get a lot of this as well. Again, kind of the same things in terms of teenagers. I wouldn't say that there's much difference other than we can probably provide a little bit more insight, background, details, that sort of thing. Let's do one more. Um, the one more question is, how do I decrease shame or thoughts of failure regarding receiving treatment um, and my failure as a parent? Um, I think the most important thing is loving kindness. Kristen Neff is an excellent resource for self-compassion, and that can really help. I know she has a book. She also has um, lectures online, a lot of different materials, a workbook that goes along with the book. This can be a really important resource for individuals who are receiving treatment. Now, oftentimes someone is using substances or is having a struggle with mental health because of trauma. Another good resource for that is Janina Fisher's The Living Legacy of Trauma. It's a really educational workbook, easy to go through for the most part, right? Trauma is not always easy to talk about, but I think that's a really good resource.